This segment is sponsored by Steckenstein's Cosmetic and Family Dentistry.
Welcome back, everybody. It looks like I'm lounging.
Yeah, you look comfortable.
I am
Yeah.
comfortable. I'm here with Dr. Jacob Steins from Steckenstein's Family Cosmetic Dentistry in
Yeah,
Grand Island. Thanks
absolutely.
for having us.
Thanks for coming down.
Yeah, I'm not usually the patient, but this morning we're talking about something, and you're going to show how you do this, and I
Yeah.
am going to be your patient. So
Yeah.
red light, you tell
Red
me.
light therapy.
Red light therapy.
It's very common. I mean, people have seen red light beds. They've seen low-level lasers. Some people have heard of what's called like a cold laser. It's all kind of the same idea. It's a focused amount of red light in a specific wavelength to help achieve a goal. And our goal on our side of things is to reduce pain and inflammation for people.
And why does red light do that?
Yeah, so I mean, the cell interacts with light. I mean, whenever you look at kind of the basics of lights, there's things called photons, okay? And photons is the energy that comes out of the light. When we look at the specific wavelength that's in that red dimension, the cell tends to absorb that a whole lot better. And so do the blood vessels as well that are surrounding a lot of those structures.
Because it's interesting, I'm looking at the picture here
Yep.
on this machine, and it's showing where you would be putting that red light on a patient,
Yep.
right?
This helps my team kind of focus the direction of the light to the spots that we want it. Obviously, we're head and neck people, so we're looking at that from that dimension. But I mean, a lot of this type of technology has been around in chiropractic offices, been around in physical therapy, osteo. Honestly, it first came out for equestrian. They were using it for horses to help keep horses reduce inflammation so that they could continue to keep running these races. So it's been around for a while. It's nothing new. It's just something that we've adopted because we do treat a lot of people with jaw joint and muscle pain.
Yeah, because like if you ever had TMJ and things like that, it just really aches. And you were asking me about tension I feel, and I do feel it on this side sometimes in the morning when I wake up, or I just know that I'm really clenching at nighttime.
And most people just live with it. They just think it's just something that's there to stay. Some people misconstrue it with pain from the ear, and so I'll have patients who come in who think that they've got an ear problem. It's actually a jaw joint thing. And so I just find a lot of patients that we're kind of asking more about it. And when you start asking about it, man, the well really opens with how many people are experiencing this day to day. And sometimes it's really getting in the way of their daily living.
So what do you do for a patient when they come in with that pain and with your machine here?
Yeah, so good candidates for this are people who have really tight muscles. I mean, they can almost feel like they wake up in the morning, they're kind of doing that almost jaw range of motion. They know they're kind of stretching everything back out. Those types of people, or people who have experienced a whole lot of chronic headaches. You see people with tension style migraine headaches above the eyes, above or below the eyes, and also kind of around here in the temples as well. What we do with those is we kind of come up with a diagnosis. We figure out, is this something that we think is potentially going on with the jaw joint, and the symptoms are kind of downstream of that. And then we recommend kind of a sequence of red light imaging that usually involves seeing them more frequently in the beginning and then tapering off from there.
You just said something that makes me realize that whenever I get a migraine, it's usually when I wake up in the morning.
Yeah.
And I bet it's what you just said. And it's usually behind one eye.
Yeah. And I tell patients all the time, migraines, there's a lot of different factors that play into there.
Yeah.
And I never tell anybody treating their joint problem is going to fix the migraine.
Sure.
But if they have migraines and they have a joint problem, the migraine's always worse. It's always worse. So if you can take back one of those variables, then they tend to get better a little bit quicker, and we figure out where it's really coming from.
Should we show how this works? And I'll just take some naps while
it's
you
very
do your
simple.
job.
Whenever you hear the term,
simple.
you ever hear the term laser, sometimes that seems kind of scary, but this is a cold laser that we're using, and so you probably won't feel anything as I'm using this.
Okay.
The way that we use this on patients is we just take where their muscles at. Muscles are kind of long, and we just apply red light. And so as you're hearing that beeping, that's that pulsed laser going in there and helping reduce that inflammation in there. Treatment time, typically about 4 to 5 minutes per site. Most patients are in and out of here in 20 to 30 minutes.
Wow, that's convenient.
And then based on where they're hurting and how much we need to do, we talk about how many times we need to see them per week, and just come up with a very individualized package. But outside of that, that's all you're really going to feel.
And I'm not feeling anything, but that being, on my side of my face right now. And so it just depends on how much tension I feel in this, that you would say maybe a couple treatments might work on it.
Yeah, absolutely. And
Wow, that's easy peasy.
it's anytime somebody has a flare up, they're coming through, we're doing the first time. Obviously, we're going to see them a little bit more often the first time. But then we see how things go. Things pop back up. And sometimes it's a thing that we have to see folks for multiple times per year. We've got other things that we do. We make some custom fit appliances for the mouth to help kind of prevent these flare-ups from happening. But we'll put together a package that really helps minimize this stuff and helps reduce the amount of this that we need to do for you.
Here at Steckenstein's Family Cosmetic and Family Dentistry, they do everything. And it's the happy place to come. It's my new happy place.
Especially when you're getting this done, right?
Yes. I mean, this is just amazing. So people can call and talk to you about this.
Call our front team, 308-382-4440. Our office website is gismiledocs.com. So look us up. Lots of information on there, lots of photos, and come meet us and let's chat it out.
Great team here, great group. So thank you. I'm really relaxed right now.
Good.
So thank you for letting us
turn the lights down. Let's take a nap, okay?
Please do. The music would be nice too. So all right. Thanks, doctor. Appreciate it.
Thanks so much.
And we'll be back. Stay with us, friends.